This is a guide to the ARCP requirements of your CT1 year and how to navigate through them. The first document you need to be aware of is the ACCS curriculum. It's quite a long read, but it does have some useful forms at the end for assessments, meeting with supervisors, etc. Having said that, try to do as much as possible on the LLP rather than paper forms. It makes it much easier to find later on, both for yourself and your ARCP panel at the end of the year. Your main guide for the year is your ARCP CT1 checklist. It has everything listed that you need to present to your ARCP panel at the end of the year so that you can progress onwards. So these are the ARCP outcomes that you're aiming for, and you're aiming for an outcome 1. This is awarded if the ARCP panel are happy that you're progressing as expected and means you can move on to your CT2 year next August. So we're going to go through everything you need by literally going through the ARCP checklist one item at a time and talking about each piece of evidence. You can see there's an orange document icon in the top left-hand corner of the screen. This means that there's a paper document that you'll need to complete, sometimes by hand and sign, and then scan and upload onto the lifelong learning platform. Next to each orange icon is the name of the document, and these are all available on the Deanery Anaesthetics website for you to download and populate. The ARCP checklist is your guide for the year, but you also need to fill it out before your ARCP as a declaration that you've presented each piece of evidence on your LLP, and it's a good opportunity at this point to use it to flag up the locations of any of this evidence, especially the bits that are harder to find, so that your ARCP panel can find them easily. Once you've completed it, just create a personal activity and label it as an ARCP document. Then upload the document as supporting evidence within that activity that you've created. The second item on the list is your Structured Training Report, or ESSR. These get sent to your educational supervisor, who will be an anaesthetist. So this is a screenshot of the LLP homepage, and this is where you create the ESSR form. Traditionally, you only do one of these per year, but in CT1 you need to do one at the end of each placement, and you will also need to do another one or maybe two on top of this for any other meetings with your educational supervisor, but we'll talk about that later on. Don't create an ESSR until you have all of your evidence uploaded onto the LLP. Once you set the dates on the form, it scoops up any entries within those dates, and your educational supervisor and college tutor can't see anything that's added after that. So make sure you've got everything ready that you want to be included before you send it off. Also remember that the ARCP panel can't see any of your evidence, or at least they couldn't this year, until the form has been completed by your supervisor. So please get everything ready and meet with your supervisor and send the form off with plenty of time to spare at the end of the year, so that they have a chance to complete it. It's not fair to just leave them a matter of hours or days to complete it in advance of your ARCP deadline. At this point, I'm just going to have a brief sidestep just to look at the LLP itself. So there's no substitute for going onto your own account and just working your way around the platform and seeing how each section works. But this is just a quick overview of it. The logbook doesn't need to be used at all in CT1, so you can temporarily ignore it while you can, because you'll need to start using it in CT2. Your name will appear in the top right hand corner, and this is where you can view your profile, edit some of your details. Some aren't editable, but if any of them are incorrect, you can just contact the college and the college can change them. The donut of progress is a visual representation of your curriculum. Unfortunately, yours isn't going to turn green in CT1 because of the way the ACCS curriculum is displayed within the LLP. The only way to send the units, to turn them green, is to send cut forms or completion of unit of training forms. but it's been decided that these shouldn't be sent in CT1 because of the way the curriculum works. So unfortunately, you can only start turning the wheel of progress, the donut of progress, green in CT2. The new entry section is where you can send assessments, you can create personal activities which let you document anything, basically from uploading evidence of courses, and you can document meetings with clinical supervisors on there. And the development section has everything else you'll need and is all pretty self-explanatory. So you can create a workplace-based assessment here on the home page, and when you do, you will have lots of type of assessments that you can send out. Your options will look something like this. So the ones under the acute medicine and emergency medicine headings are the only ones you will use this year. As you scroll down, there will also be anaesthetic and intensive care options, which you'll start to use in CT2. As we can see, there are several different types of workplace-based assessment to send out. So mini-KEXs are designed to assess an observed clinical interaction. CBDs are case-based discussions where there are opportunities to talk about a whole case you've seen and any interesting learning points from it. DOPS are directly observed procedures, and I'm sure these are all formats you've encountered before. There are also ACCS assessments, which are used to observe a chunk of clinical practice beyond a single case. For example, you might present 5 or 6 people you've clerked on the medical ward to the post-date ward round, or you might have managed several patients in resus over the course of an A&E shift. So the assessment can look at the way you've prioritised tasks, managed time, worked within a team, as well as how you assess and treat each patient. So you normally have around 5 patients or cases per ACAT. The important things to notice here are that in emergency medicine, they differentiate between summative and formative assessments, and we'll see why that's important in a minute. Also, there's only the option to send an audit assessment tool or teaching observation in acute medicine. This doesn't mean you can't do these in emergency medicine as well. I'm not sure why they're confined to acute medicine only, but just send the assessment and then make it clear in the description that you undertook it in your emergency medicine placement, if that's the case. Some of these have to be completed by a consultant, and that's specified in your checklist. If it isn't specified, then they have to be completed by a registrar or above, but try and get as many consultants as possible. There was some discussion at the induction day about associate specialists fulfilling the role of a consultant with regards to assessments. While associate specialists aren't consultants, there are some cases where this may be necessary, and they're already fulfilling consultant-like supervisory roles as well. If this is the case, you'll need to make sure that you've acknowledged this and documented reasons for any discrepancies from the checklist in your portfolio. A good place to do this would be on your completed checklist when you upload it at the end of the year, and or on your end of year ESSR. If you think this is going to be something that's going to apply to you and you're going to need to use associate specialists multiple times in place of consultants for assessments, just please discuss it with your educational supervisor early on in the year, just so that you can clarify that everything's okay. All or almost all of your workplace-based assessments will be completed by specialty doctors who aren't anaesthetists and therefore don't have an account on the LLP. So you'll just need to select them as a guest assessor. So just remember you're going to need their name, their email address and their GMC number in order to do that. The workplace-based assessment requirements in terms of type are set out here. You have to meet these minimums, although I've got to say it's virtually impossible to get everything covered just doing the minimum. So you'll end up doing in quite reasonable excess of this number by the time you've got everything done. Multi-source feedbacks will be familiar to you, and you'll need to get 1 per placement, so 2 over the whole year. There aren't minimum requirements for the type of health professional, but you do need at least 2 consultants and as good a mix as possible for the other 10. Once you've sent the form, you can add more names if needed, and you can also close the assessment before everyone's responded. So if, for example, you've sent out 15 requests If you've had 12 back, you can then close the form to say that you've had sufficient responses and you don't want to keep it open any longer. Your measured activity is the number of cases you've seen in emergency medicine. Your activity isn't formally measured in your acute medicine placement. You need to mention this to your clinical supervisor during your initial meeting so that you both know how the information is going to be obtained at the end of the 6 months. It can normally be extracted from the A&E system that you use for patient allocation and patient tracking throughout the department. Towards the end of your placement, get your number and discuss it with your clinical supervisor and your educational supervisor during your meetings. As long as everyone's happy, it can then just be formally documented in your ESSR form at the end of that placement. There used to be a target of seeing 800 patients in A&E over 6 months, but the number that you actually see can vary widely based on where you spend your time. So, for example, you'll see far more patients per hour if you're in minor injuries than if you're in resus. So this number's been scrapped now, and you basically just need the okay from your supervisors that they're happy with your level of activity. So common competencies are a list of 25 areas of development that are common to all specialties and need to be developed during your training. Each one is listed as a curriculum item on your LLP, as seen here. So this is just a snapshot of the start of them. Every time you send out an assessment, try and link it to one or two of these 25 common competencies that are relevant before you send it out. It's important to note you can't go back and link to a curriculum item after the assessment has been sent. So just start thinking about these early and get linking early. When a piece of evidence, probably a workplace-based assessment, has been linked to a common competence curriculum item, the item itself on your LLP will turn amber. The only way to then turn it from amber to green is to send off a cut form, which it will give you the option to do. But like I mentioned earlier, it's been decided that this isn't a suitable way to assess the common competencies, so please don't send out any cut forms. You don't have to have something linked to all 25 of these common competencies by the end of the year. The requirement is only to actually have linked pieces of evidence for 50% of them, but try and get as many as you possibly can by the end of the year with some sort of evidence attached. So once you get to the end of the year, you're going through all of your evidence. You need to give yourself a rating for each of these domains based on the level descriptors. Now, these are all listed in the curriculum, but it's a very long-winded way to find the information. So I've created a summary document with each of the 25 common competencies and their respective levels of competence, and most are graded from 1 to 4. So you pick the level which best describes you and you note it down. You're then expected to be at level 2 or above in at least half of them by the end of the year. And the linking of your workplace-based assessments throughout the year is your evidence to show why you're rating yourself at the level you're rating yourself at. Once you've given yourself a rating for each of these common competencies, your educational supervisor will then do the same, and then you sign and upload the document. As you can see, there's a template ready-made for you. So this is called CCs, and RL are just my initials, and that's on the Deanery website for you to download and to fill out, like I've said. So we've looked at the types of workplace-based assessments that you need to obtain over the year, but now we need to have a look at the presentations that need to be covered by these workplace-based assessments. So these are divided into core major presentations, of which there are 6, and these are listed here. Core acute presentations, of which there are 38, and we'll come on to those in a second. And then core practical procedures, which are almost all covered by DOPS, and again, we'll come on to these in a minute. As you can see, there's a grey document icon here, That's because there's a summary sheet online which has all of these listed and can be printed onto a single sheet of paper just for you to carry with you over the whole year, and you can tick things off as you go. It's grey, the icon's grey because it's for your reference only, and you don't need to upload it onto your portfolio for your ARCP at the end of the year. There's also a spreadsheet version of the same information on the deanery website as well. If that works better for you, it's whatever works best, just so that you can keep a track of how you're going. It's expected that you will see at least 4 of these 6 core major presentations over the year, but probably you'll come across all 6. The minimum for each placement is a consultant assessment in 2 of these using a mini-KEX or a CBD. But try hard to get all 6 done, and it'll make life so much easier in your CT2 year. As you can see on your checklist, your A&E consultant assessments need to be summative. If you can remember, there's a differentiation between summative and formative in emergency medicine, but not in acute medicine. If you're really struggling or running out of time to get cardiorespiratory arrest assessed by a consultant, you can be assessed for this in a simulation course, so either a trust arrest simulation or an ALS simulation. Try and get it done in a clinical scenario, but if you're really struggling, then you can resort to that at the end of the year. So as I said, there are 38 core acute presentations, and these need to be covered over 2 years. But as you can see, you need to cover 19 per placement. So if you try and avoid repeating them in your assessments, you'll soon complete all of them in CT1. Again, I can't stress this enough, how there's enough work to do in CT2 as it is, without mopping up assessments from this list. It's also not that easy to get an assessment for reviewing a painful ear when you're on your anaesthetics or your ICU placement. It's just one of those things that's just much better, much easier to get it done in A&E. The 5 which are shaded need to be completed in A&E, and again these must be a consultant assessor, and they've got to be done on a summative form. Although 10 per placement need to be completed with workplace-based assessments, the other 9 can be covered using different kinds of evidence, such as e-learning, reflections, teaching, audit, or you can just do more assessments if they're the opportunities that are presenting themselves. There are 45 core practical procedures which need to be completed over the 2 years, and unlike your core major presentations and core acute presentations, there are a number of these that have to be done in your CT2. So numbers 22 to 45 have to be completed in CT2, and they cover things that predominantly you won't come across anyway. They're quite anaesthetic specific, so you won't get the opportunity to do them in acute medicine or emergency medicine. Numbers 1 to 4 are things like cannulation, arterial blood gas sampling. So whilst these do have to be done again in CT2, if you're low on numbers for a placement to get enough DOPs, they do make for quick, easy DOPs if you want, but you will have to do them again in your CT2 anyway. As you can see on your checklist, there are 4 which have to be completed in A&E, and you have to have done a minimum of 5 in total for each placement. Although I know I sound like a broken record, but try and complete as many as possible of the first 22 that you can in your CT1 year, if not all of them. The core practical procedures don't have neat blocks within the LLP curriculum like the common competencies, the major presentations and the acute presentations do. So it's difficult for the ARCP panel to see what you've done at the end of the year. For this reason, link them to the most appropriate presentation or common competence when sending them out. So, for example, if you were doing a lumbar puncture, you might link it to infection control common competence, for example. And then there's another summary form that I've created called Core PPs, which is, again, on the deanery website. You can download it and fill it out and basically summarise all of the docs you've done over the year, which procedure they cover, which part of the curriculum you've linked them to, and when you sent them out. This just then is a summary for the ARCP panel to look at so that they can use it to find the DOPs that you've done over the year. And they can quite easily reference them, especially if you've put the curriculum links on. That's how they can navigate their way around your portfolio to find them. So this is just a summary table on the checklist, telling us what we've just been through really in terms of the minimum requirements per placement, divided amongst your core major presentations and your core acute presentations. The everything else table just covers a few extra bits. So you need to do at least one audit per year and then just send off an audit assessment tool to evidence this. Your regional teaching can be booked via the MELLEARN website and you need to attend 80% of it. If you're organised and you book early and apply for study leave early, 80% is very possible as long as you plan ahead. The CT1 simulation courses, they're normally organised locally in your trust, so there'll be someone who will be able to locally tell you when the next one is. ALS provider certificate, so that's pretty self-explanatory. You just need to have an in-date provider certificate and then just upload it onto your LLP. The e-learning for health platform has some really good e-learning topics for everything. So for emergency and acute medicine, as well as going on to anaesthetics for you next year. It also includes the safeguarding modules, which have to be completed in CT1 levels 1 and 2. If you've been involved in any complaints, critical incidents or serious untoward incidences, then there should be evidence in your portfolio already. It should be added at or near the time of the incident, including reflections and any actions that you've taken. But then these also need to be declared on your ESSR form and your Form R at the end of the year. Speaking of which, your Form R normally gets emailed to you towards the end of the year with guidance on completion, but you can also download it from the Deanery website if you need to. If you take any sick leave or time from training for any reason, keep a record of it and make sure it's accurately declared on your ESSR and then your Form R as well. The Health Education Yorkshire and Humber Trainee Feedback Survey is normally sent out in the autumn and it's also called the NET Survey. So keep an eye out for it and chase it if you haven't had an invitation to complete it. And yeah, just make sure the two names for it sort of cause a bit of confusion over the last couple of years. The same applies to the GMC survey in the spring. Just keep an eye out for it, and once you've completed it, either of them, you can just take a screenshot of the completion page with an identifier for you somewhere on the screen, and that's sufficient to upload onto your portfolio as evidence of completion. You will need to meet with your educational supervisor at the start of the year and at the end of each placement as a minimum. You will also need to meet with them at the start of your second placement if you're moving trusts halfway through the year. For every meeting that you have with your educational supervisor, please create an ESSR. This might seem a little laborious, especially for the beginning of year meeting, as there won't be any evidence in your portfolio to review yet. But it means that all the trainees will have the same format in your e-portfolio at the end of the year, and it'll just make it easier for the ARCP panel to find everything. Also, some of the fields in the ESSR, I'm told, should self-populate when you create a second or a third form, so possibly making your life easier too. For your clinical supervisor meetings, just create a personal activity and document everything you've discussed in the free text box. Some departments like to go through an initial meeting pro forma just to make sure you're happy, that you've had a proper induction, you know where everything is, you know what your responsibilities are, etc. If that's the case, then you can just scan the paper evidence of your meeting and attach it within the personal activity and create it that way. Right, so that's everything. Thank you for listening. If you have any questions at all, your first port of call will be your clinical or your educational supervisor, based on the type of query. And then after that, you can always get in contact with your TPDs. If you want to know anything specifically about the forms that I've created, then I'm also available as a non-official source of information or support if needs be.